Me, Dr. Eman Moeen. Today we will be discussing about cervical screening during pregnancy. If you find my videos useful, please like, share and subscribe. So if you get a woman during her pregnancy for the cervical screening, then you have to check about her previous cervical screen test, which nowadays is high risk HPV. If her previous test was normal and she is just for the routine screening, then you can defer it up to 3 months postpartum. But if it was an abnormal screening test, then you have to do colposcopy in the late first or early second trimester. This is usually falls between 3 to 6 months of the pregnancy. Okay. Now, what are the indications for the colposcopy in the pregnancy? You have to do the colposcopy if any abnormal cervical screening result is there, if you have the concerns regarding the appearance of the cervix, for whom we can delay the colposcopic assessment. If a pregnant woman requires colposcopy or a screening sample after treatment or follow-up of untreated CIN1, their assessment may be delayed until after delivery. If a woman requires colposcopy after CIN1 that is untreated, so usually we put these patients on the conservative management. Okay, so if these women require the colposcopy during pregnancy, we can delay this till after 3 months postpartum. Now there is a second option. We have another set of women who are already treated for their disease like CIN2 or CIN3. What is the treatment for that? The treatment for that is large loop excision of transformation zone. Now these women have done their treatment and they are now due for the test of cure at 6 months, and this test of cure is high risk HPV. Okay, high risk HPV. Now we have to check whether on the biopsy, the tissue that was taken on the LEDs, how are the margins there. If the margins are clear, we can ask the patient to do her colposcopy or her test of cure after delivery. Okay, but if the margins were positive or uncertain, then you have to ask your patient to do the test of cure, that is high risk HPV, there and then. So let's revise this concept again. Now this is the woman after treatment. If the biopsy shows uncertain margins or margins are positive for the disease, the test of cure should not be delayed. If the test of cure is negative, then you follow her up according to the protocol. If the test of cure is positive, that is high risk HPV is positive, we do cytology. If the cytology is low grade, we do colposcopy after delivery. But if the high risk HPV is positive, cytology is of high grade, then you have to do the colposcopy there and then during the pregnancy. What is the aim of the colposcopic examination of the pregnant individual? The main aim is to exclude the invasive disease and to defer the biopsy or the treatment. So once you are doing the colposcopic evaluation of a pregnant individual, like here, colposcopic evaluation of a pregnant individual require a high degree of experience because of the changes during the pregnancy. If on colposcopy you suspect that it is CIN1 or less, you suspect that it is CIN1 or less, then the treatment should be according to the algorithm for the CIN1. But if you suspect that it is CIN2 or CIN3, on the colposcopy you suspect that it is CIN2 or CIN3, then you have to do the colposcopy at the end of the second trimester. If the pregnancy has already advanced beyond that point, repeat 3 months following delivery. So what is the reason or logic for doing this colposcopy here again at the end of the second trimester? Because here we see that we are suspecting CIN2 and CIN3 and it has the higher chance of progression to the invasive disease. If CIN1 is suspected on the colposcopy, you can manage her conservatively. But if you suspect CIN2 and CIN3, then repeat colposcopy is required at the end of second trimester because we want to rule out if there is any invasive disease. If the pregnancy has already advanced beyond that point, then you have to repeat it 3 months post delivery. But on colposcopy, if you suspect that it is an invasive disease or you suspect it clinically or colposcopically, that is the indication for the colposcopy was therefore the abnormally looking cervix or the suspicious of an invasive disease. So whenever you see that the cervix is clinically abnormal or colposcopically abnormal, a biopsy adequate to make the diagnosis is required. Okay, because some of the excisional treatments are safe in the pregnancy in the first and the second trimester, but then you have to counsel your patient that these excisional treatments are associated with a high risk of hemorrhage, and such biopsy should be taken only where appropriate facilities to deal with the hemorrhage are available. Punch biopsy suggesting SIN only cannot reliably exclude the invasion. So whenever you suspect the invasive disease, then you have to do the excisional biopsies. Okay, that's all for today. Thank you everyone for watching.